In the summer of 2025, the United States Department of Justice, in an unprecedented move that would mark the largest healthcare fraud takedown in American history, publicly announced the culmination of years of coordinated investigation, analysis, and enforcement efforts that together formed what came to be known as the 2025 National Healthcare Fraud Takedown, an accompanying series of prosecutions that ultimately led to the criminal charges against 324 defendants spread across 50 federal justice judicial districts and supported by 12 state attorneys general's offices, with allegations that together represented over $14.6 billion in intended losses to federal health care benefit programs such as Medicare, Medicaid, and TRICARE, and other government funded insurance systems, all of which were financed hardworking American taxpayers and designed to support health and well being of seniors and disabled veterans and other vulnerable populations. At the core of this takedown was not an isolated investigation into a single fraud ring, but rather a multi agency nationwide enforcement action involving collaborative efforts from the Department of Justice Criminal Division, the Healthcare Fraud Unit, U.S. Attorney's Office across the country, the Department of Health and Human Services, Office of Inspector General, HHS and OIG, and the Federal Bureau of Investigations and Drug Enforcement Administration, DEA, the Centers of Medicare and Medicaid Services, CMS, and numerous state partners, all aligned in a whole of government approach to expose, disrupt, and prosecute the complex schemes that exploited the systematic weaknesses in the nation's healthcare financial systems. What made the 2025 takedown so unprecedented was not only the quantity of defendants, including the 96 licensed medical professionals, such as the doctors, nurse practitioners, and the pharmacists, but also the breadth of the diversity of the alleged fraudulent schemes and the sweeping impact of the criminal conduct. These schemes took many forms, from massive telemedicine-based fraud that generated over $1.1 billion in fraudulent billing by paying kickbacks to medical professionals, to order unnecessary equipment or tests, to schemes where stolen identities and customer data were used to submit fraudulent Medicare claims in amounts of tens of billions, to prescription drug diversion and opioid trafficking cases involving over 15 million illegally diverted controlled substance pills, to even more traditional categories of healthcare fraud that involved billing for medically unnecessary service treatments never provided or inflated services that bore little relation to legitimate patient care. Excuse me. The Department of Justice described these enforcement actions as a record-setting healthcare fraud takedown because the combined alleged fraud had more than doubled the prior record as of such cases, previously hovering around $6 billion in claim losses, highlighting the expansion and sophistication of fraudulent actors in the healthcare space. Attorney General Pam Bondi, in announcing the takedown, emphasized that the enforcement action delivers justice for the criminal actors who prey upon our most vulnerable citizens and steal from hardworking American taxpayers. A sentiment echoed consistently by federal officials who stressed that the schemes were not victimless crimes, but rather financial and physical harms that eroded public trust, undermined the patient care, and compromised safety, and threatened the long-term viability of the programs that millions of Americans depend on. The scale of the takedown was stunning. Law enforcement efforts resulted in the seizures of more than $245 million in illicit proceeds and assets that included cash, luxury vehicles, cryptocurrency, and other property believed to be purchased with fraud proceeds, representing a significant but small fraction of the alleged total because so much of the fraud was still under investigation, or the funds had already been spent, hidden, or transferred overseas. At the same time, CMS announced that it prevented more than $4 billion and fraudulent payments by suspending and revoking the billing privileges over 205 providers whose billing practices appeared suspicious or demonstrably out of compliance with the program's rules, and an indication that agencies had moved beyond the traditional pay and chase model, where the agencies pay claims first and then try to recover the funds later, toward a more proactive approach that uses data analysis and real-time monitoring to stop fraud before it occurs. The multifaceted nature of the allegations extended across numerous types of fraud. For example, one of the largest identified schemes known internationally among investigators is Operation Gold Rush, centered on a complex transitional fraud network allegedly involving foreign straw owners, encrypted communications, and sham medical supply companies that were strategically used to submit fraudulent Medicare claims for items such as urinary catheters, continuous glucose monitors, and other equipment that were often medically necessary and, in many cases, never received by beneficiaries. According to the court filings and charging documents, these companies purchased or acquired Medicare enrollment medical supply firms, used the stolen identities and the personal information of over 1 million Americans, and submitted about $10.6 billion in false claims to Medicare. Federal officials later explained that the HHS, OIG, and CMS, using advanced data analytics, were able to detect anomalies in billing patterns, such as outlier volumes of specific durable medical equipment claims that bore no relation to the population's health needs, or ultimately prevented all but approximately $41 billion of the roughly $4.45 billion that was scheduled to be paid from Medicare before the schemes were halted. Nonetheless, the depicted billing had already triggered at least $900 million in payments from private Medicare supplemental insurers and left an enduring trail of compromised data and deception. In another example, from the Southern District of Florida, a clinical owner was charged with submitting nearly $3 million in false claims to Medicare and Medicaid for durable medical equipment that was unnecessary or not provided to patients, illustrating how local level providers would exploit federal systems with false documentation and inflated changes that defy the clinical necessity. Similarly, prosecutors in the Western District of New York charged foreign-based individuals for alleged ordering durable medical equipment for Medicare beneficiaries without meaningful patient contact or medical necessity, an example of how the scheme extended beyond the domestic borders and into the realm of intentional exploitation. The prescription drug diversion and opioid trafficking also feature prominently in the Takedown. According to the Justice Department, detailed a release of 74 defendants, including 44 licensed medical professionals, were charged in connection with cases involving the illegal diversion of millions of pills of prescription opioids and other controlled substances, with certain pharmacies in Texas accused of unlawfully distributing over 3 million opioid pills and were subsequently trafficking by street-level dealers. Federal law enforcement officials noted that these cases are part of a broader effort to combat not only financial fraud, but the public health harms as the fraudulent prescribing and pill distributions, which have fueled the nation's opioid epidemic by creating additional sources of addictive drugs outside lawful medical oversight. Now, the public narrative around these enforcement actions was further complicated by individual stories that surfaced in the local reporting, such as a case of a Connecticut nurse who pled guilty to charges connected with illegally prescribing controlled substances without popular medical evaluation, with federal authorities alleging that at least 5 of her patients died shortly after receiving the prescriptions in the scheme, where she charged Medicaid patients cash fees for controlled drugs without legitimate medical justification. underscoring how fraudulent conduct can directly endanger patient safety, not just defraud government programs. In that case, the alleged behavior came to a light when the federal agents received complaints from pharmacists who observed dangerously improper prescribing patterns, prompting undercover operations and eventual arrests. A stark example of how fraud can intersect with life or death consequences. Throughout the summer of 2025, news coverage and official press conferences reinforced the message that the takedown represented a major strategic shift in the government's approach to healthcare fraud, one that recognized fraud as national security and public health threat as much as a financial crime. The officials frequently emphasized that the fraud schemes often involved organized and sophisticated criminal enterprises, sometimes with ties to international networks in Russia, Eastern Europe, Pakistan, and Estonia, and other regions that exploited stolen identities, shell companies, and complex financial arrangements to conceal their activities and they extract money from federal systems with impunity until detected. Now, importantly, while 14.6 billion figure of dollars grabbed headlines as a measure of the intended fraud, government officials also acknowledged that the actual loss of the federal coffers, meaning the amount of the actual paid out before detection, was notably lower, with estimates around 2.9 billion in direct expenditures, a distinction that reflects the intense work done by the data analytic teams in the CMS and HHS to intercept and halt fraudulent claims before they could be paid. This distinction underscores the evolving role technology and analytics in fraud detection, but also highlights the sheer scale of the attempt fraud that can materialize in modern healthcare systems when oversight mechanisms are outpaced by the determined but are determined to exploit them. Now, even as the federal authorities describe these enforcement actions as victories, they acknowledge that such fraud schemes reveal systematic vulnerabilities in healthcare billing, provider enrollment, identity verification, and prescription monitoring and provider oversight. Vulnerabilities that criminals can exploit through increasingly sophisticated methods, including artificial intelligence, encrypted communications, shell corporations, internal straw owners, and stolen personal health information. The Justice Department enforcement effort therefore served not only to pursue individual criminals, but also to highlight broader weaknesses in the healthcare financing system that require ongoing reform and better real-time monitoring, enhanced identity protection for beneficiaries, and a stronger collaboration between the public and private insurers to detect and deter fraud before it takes root. From a patient perspective, the takedown brought renewed attention to the reality that healthcare fraud is not merely an abstract financial crime, but practice that can undermine the quality of care, compromise patient safety, and erode public trust in health systems that are meant to serve the sick and vulnerable. Healthcare fraud, whether through medically unnecessary procedures, sham consultations, illegal prescribing practices, or fraudulent billing, diverts resources away from legitimate care and contributes to the rising insurance premiums, which imposes a hidden cost on everyone who participates in publicly funded programs. It also places undue strain on the providers who strive to deliver the high-quality care, as they must contend with the systems that can be gamed by bad actors who undermine ethical practices and exploit loopholes for profit. At the macro level of the 2025 National Healthcare Fraud Takedown spotlighted the importance of the interagency cooperation, advanced analytic, and sustained oversight in combating fraud that transcends traditional boundaries and employs tactics previously seen in financial crimes or organized cybercrime rings. It demonstrated that bringing together the expertise from law enforcement and health regulatory agency data, scientists, and fraud investigators, the government can uncover patterns and connections that would otherwise remain hidden and shielded by lawyers of corporate and technological obfuscation. Now, let's okay. Looking beyond the immediate enforcement actions, analysts and stakeholders noted that the takedown could influence future policy and operational changes designed to enhance the fraud detection and prevention mechanisms, from strengthening provider enrollment vetting processes to improving beneficiary identity safeguards, from requiring greater transparency and telemedicine billing to enhance prescription monitoring. Databases that can flag typical prescribing patterns before they cause harm. The lessons learned from the 2025 enforcement action were expected to ripple through the regulatory reforms, industrial practices, and the legislative agendas aimed at fortifying trust in public health programs, while also ensuring that taxpayer dollars are spent to legitimately medical or to legitimize. I'm sorry. Legislative agendas aim to fortifying trust in public health programs while ensuring that taxpayer dollars are spent on legitimate medically indicated care rather than lining the pockets of the fraudulent actors. But by capturing the detailed scope of the schemes, the nature of the charges, and the interagency coordination necessary to pursue such a large complex takedown, and the tangible costs and other implications, the narrative of the 2025 National Healthcare Fraud Takedown stands as a defining chapter in the ongoing struggle to protect the integrity of the United States healthcare system and to shield its citizens from exploitation and harm. Following the initial announcement of what the Department of Justice terms the 2025 National Healthcare Fraud Takedown, the legal and investigative aftermath grew into one of the most expansive and complex enforcement efforts in United States healthcare history, involving follow up prosecution, plea agreements, civil false claims, acts, actions, assets, forfeitures, and detailed judicial processes that would stretch well beyond the summer of 2025 as the prosecutors pursued the accountability in the courts across the country, meticulously building cases that laid bare not only the vast financial scope of the fraud, but also the human costs and the operational mechanics and systematic vulnerabilities that made such abuses possible in the first place. The core of the takedown of criminal charges against the 324 defendants was elevated by accompanying civil actions, including the false claims at the FCA suits against additional parties that collectively added millions more in alleged fraudulent losses and recoveries, with civil settlements and judgments reported that further underscored the pervasive nature of the misconduct treated by authorities. In the months following the June 30th, 2025 announcement, United States Attorney's Office from the Northern District of Texas to the District of Nevada each issued press releases detailing their individual prosecutions that were part of the larger coordinated effort, illustrating how widespread in the alleged conduct was and how it manifested differently in local jurisdictions while still trying while still tying into the overreaching enforcement strategy. In the Northern District of Texas, for example, prosecutors charged four individuals with fraud schemes totaling more than $210 million in part of the takedown, involving fraudulent billing to Medicare and other health care benefit programs, actions that demonstrated how regional fraud networks could parallel and interconnect with determined or to the national patterns of exploitation, were emblematic of the types of schemes the Justice Department was determined to dismantle. In Las Vegas, the United States attorneys in the District of Nevada announced changes against defendants accused of participating in similar schemes, further emphasizing the federal prosecutors coast to coast were actively prosecuting these complex cases and bringing to light the intricate web of defendants, shell companies, and bogus billing operations that had defrauded federal programs. The legal proceedings that followed were marked by an array of charges that included conspiracy to defraud Medicare and Medicaid, criminal false claims violations of the anti-kickback statute, money laundering, unlawful distribution of controlled substances, and aggravated identity theft, with prosecutors presenting detailed indictments and factual bases for these allegations in federal court. Investigations and subsequent indictments revealed how some schemes relied on pay for patient arrangements and kickback agreements where patients broker and operates on halfway houses or assisted living facilities, which would deliver individuals to treatment centers owned by co-conspirators who would then submit claims for services that were unnecessary or entirely fabricated, siphoning millions of dollars from the federal programs in the process. One particular striking example of individual criminal conduct that emerged in the post-takedown legal process was the case of the Connecticut nurse from Cheshire who pleaded guilty to federal charges for illegally prescribing controlled substances as part of a nationwide healthcare fraud network, often referred to by prosecutors as Operation Gold Rush, which was integrated into the broader 2025 enforcement action. In that case, the federal authorities alleged that the nurse issued Schedule II and Schedule IV drug prescriptions, often without power, medical evaluations, or legitimate medical purposes, which was charging cash payments and submitting the prescriptions to Medicaid for reimbursement. Tragically, 5 of those patients later died on the aftermath of receiving those prescriptions, highlighting the grave risks that fraudulent prescribing practices pose to patient safety beyond where the financial loss is. Operation Gold Rush itself became a local point for authorities because it involved transitional criminal organizations alleged to have orchestrated a massive network of sham durable medical equipment companies and organizations alleged to have orchestrated a massive network of sham durable medical equipment companies and take patients' records that generated fraudulent claims into the Medicare. Court documents and forfeiture actions outlined how the defendants acquired small Medicare enrolled businesses, used stolen personal information for beneficiaries, and submitted billions of dollars in false claims for equipment items and services that were never provided. And one subset of the operation, encrypted communications, nominee-owned companies, and offshore bank accounts played roles in concealing the scheme, and prosecutors highlighted how these fraudsters used artificial intelligence and falsified beneficiary consent regarding to lending a veneer of legitimacy in their fabricated claims. In New York City, Northern District federal prosecutors also secured a guilty plea from a psychiatric nurse practitioner who admitted to submitting fraudulent claims of psychotherapy services and other evaluations that were never performed, resulting in losses of the federal healthcare programs and demonstrating how exploitation could even arise within clinical settings when providers deceived insurers and patients alike for the personal financial gain. In California, charges were also filed in Northern District that included allegations of not only fraudulent billing for unnecessary durable medical equipment and other services, but also illegal diversions of prescription medications for personal use, reflecting how schemes within Takedown ranged from classic false billing to criminal acts involving controlled substances. Amid these prosecutions, the federal authorities aggressively pursued the assets forfeiture to seize proceeds of the alleged fraud, resulting in the collection of more than $245 million in cash luxury vehicles, cryptocurrency, and other assets believed to have been purchased with ill-gotten gains. Prosecutors and agents describe these seizures as not only symbolic gestures of justice, but practical means of deterring future misconduct. By depriving defendants of the financial fruits of their crimes and returning value of the victim of fraud, the American public, and legitimate healthcare providers. Beyond the criminal prosecutions, the False Claims Act, the FCA played a significant role in the civil enforcement action tied to the takedown, with the 20 civil charges alleging FCA violations and the additional settlements over the 100 defendants, bringing up tens of millions in recovered funds. These civil actions typically involved allegations that providers knowingly submitted false claims or caused false claims to be submitted to the federal health care programs, triggering statutory penalties and liability under the FCA, which allows the government to recover treble damages and substantial financial penalties for the fraudulent conduct. The coordinated enforcement of the 2025 also sparked institutional responses and the structural changes within the Department of Justice and among health and regulators. In some districts, the United States attorneys announced the creation of dedicated healthcare fraud prosecution units, which recognize the volume and complexity of these cases, required specialized expertise and sustained focus to keep pace with evolving fraud tactics. For example, in the Northern District of Illinois, authorities established a new section specifically to prosecute criminal healthcare fraud, signaling a long-term commitment to combating these schemes and acknowledgement of the significant resources necessary in which to pursue these cases effectively. Moreover, the Justice Department and the Department of Health and Human Services launched a joint task force which signals in the healthcare industry about heightened compliance expectations, proactive identification of fraud risk, and the government's willingness to vigorously pursue both criminal and civil remedies against those who misuse federal care funds. The composition of this working group reflected a strategic shift toward integrating enforcement and compliance intelligence from across agencies to anticipate strategic shifts toward regarding enforcement and compliance intelligence from across agencies to anticipate fraud trends and deploy coordinated responses that leverage the full suite of legal tools available to the government. The expansive nature of the takedown and the legal actions that followed also had broader implications for industrial compliance and regulatory policy. Healthcare providers, billing companies, and the medical equipment suppliers across the United States were compelled to reevaluate their internal compliance programs, their billing practices, and data governance protocols in light of security and legal exposure revealed by the 2025 enforcement actions. Legal analysts and industrial commentators noted that in technologies like data analytics and artificial intelligence became more ingrained in the billing and service delivery healthcare organizations, such balance of the innovations with robust oversight to prevent unintentional compliance violations that could expose the FCA's liability of the criminal prosecution. At a systemic level, the takedown highlighted long-standing vulnerabilities in federal healthcare programs, including the gaps in provider enrollment verification, identity theft protections for beneficiaries, telehealth billing oversight, prescription monitoring, and real-time fraud detection mechanisms. The sheer volume of the attempt of fraudulent claims, upwards of $14.6 billion in intended losses, illustrated how presence and adaptable fraud networks can be when incentives and safeguards are misaligned. prompting stakeholders to both the public and private sectors to call full strengthened data sharing, enhanced predictive analytics, and legislative reforms aimed at reducing the opportunities for abuse. Critically, these enforcement actions underscore the broader human impact of healthcare fraud. Beyond the billions of dollars in financial losses and asset forfeitures, the schemes targeted by the prosecutors often preyed on the vulnerable populations. Elderly patients, individuals with chronic conditions, and dependent on government programs for essential care undermine access to legitimate medical services and eroding trust in systems meant to protect the public health. Cases that involve fraudulent prescriptions practices and the illegal distribution of controlled substances further threaten how health care fraud can be exuberated public health crises, contributing to addiction, overdose risk, and unnecessary medical interventions that offer no therapeutic benefit. And congressionally mandated reporting to legislative bodies and agencies alike, the HHS Office of Inspector General's OIG highlighted how 2025 campaigns, including the takedown of the related exclusion actions, contributed substantially to their broader mission of safeguard federal health care programs, which has achieved financial recoveries and recommended reforms reinforcing the need for the vigilance, cross-agency collaboration, and the sustained investment in anti-fraud infrastructure. And the reflecting upon the legal and policy outcomes of the unfolding in the wake of the 2025 National Health Care Fraud Takedown, it becomes clear that while the immediate prosecutions and civil actions represented powerful enforcement responses, they also served as a catalyst for a deeper examination of the healthcare billing system. Provider oversight practices and the intersection of technology and fraud risk shaping the national discourse around best to protect public health programs from abuse to ensure that the taxpayer-funded care services are intended beneficiaries with integrity and with fairness. As the legal proceedings in the 2025 National Healthcare Fraud Takedown unfolded, the nation began to see the full depth of the complexity of the alleged schemes, with prosecutors meticulously documenting how individuals and medical providers and the corporate entities exploited the weaknesses in the federal healthcare system for personal financial gain. Many of the cases highlighted in Part 2 were emblematic of the broader patterns that federal investigators had been monitored for years, including the emergence of sophisticated telehealth fraud rings, durable medical equipment scams, and the illegal prescription drug diversion networks. In one high-profile case, a telemedicine company headquartered in Florida was accused of orchestrating a scheme in which doctors were paid per patient visit, not per legitimate service, resulting in the billings of over $120 million for services that were often unnecessary, never rendered, or performed through falsified patient records. The investigators described how the company employed patients recruiters who actively sought out Medicaid and Medicare beneficiaries, sometimes using coercion or misrepresentation, and then submitted fraudulent claims on their behalves, leveraging the digital platforms and software to automate aspects of the billing process, which concealing the lack of clinical oversight. In the Northern District of Texas, prosecutors uncovered a multi-layered fraud operation involving medical supply companies that supplied urinary catheters, oxygen equipment, and diabetic testing supplies. Defendants allegedly acquired small Medicare enrollment companies, obtained permanent data through illegitimate means, and then submitted claims for items that never delivered or medically unnecessary, with investigations revealing the complex networks of shell companies and the nominee owners designed to obscure ownership and the financial benefit. Law enforcement Yeah, this case was also highlighted the growing use of the data analytic anomaly detection software by federal agencies to identify suspicious billing platforms, marketing shifts, and the investigative methodology from relative audits and proactive detection. The prescription drug diversion emerged to another major area of focus in Part 3 of the Takedown. Federal prosecutors charged multiple licensed medical professionals, including doctors and pharmacies, for participating in schemes that tunneled controlled substances, primarily opioids, into illicit markets. One defendant, a pharmacy owner in Texas, was accused of distributing over 3 million opioid pills without legitimate prescriptions, often coordinating with street-level distributors. Investigators found evidence of falsified prescriptions, fraudulent patient intake forms, and deliberate misreporting to insurance programs. These cases uncovered the dual impact of healthcare fraud. Not only do such schemes result in enormous financial losses, but they also elaborate public healthcare crises, such as the opioid epidemic, by placing vulnerable populations at risk, according to data.gov. Another key feature of Part 3 was the interconnected nature of many schemes, demonstrating how fraud networks often operated across the state and national borders. Some foreign-based actors allegedly established shell companies in the United States, obtained Medicare provider numbers through nominee owners, and submitted false claims from abroad. In certain cases, encrypted communications, offshore accounts, and multiple layers of intermediaries complicated investigative efforts, requiring unprecedented levels of coordination among the DOJ, FBI, HHS, and the OIG, and state-level authorities. This multiple jurisdictional approach was critical to apprehending defendants who sought to exploit the fragmented oversight of the federal healthcare programs. Beyond the financial and operational details, Part 3 emphasized the human impact of these fraudulent schemes. Patients, particularly seniors and individuals with chronic conditions, were frequently subjected to unnecessary treatments and invasive procedures and prescribing regimes that offered therapeutic benefit. In some instances, the miscalculations of durable medical equipment and telehealth appointments prevented legitimate patients from receiving timely care. Public statements from the Department of Justice and officials stressed that the harm was not solely monetary, noting that taxpayer-funded programs were designed to support the most vulnerable Americans, and fraud eroded both trust and access. Investigative techniques deployed during the Part 3 case combined traditional law enforcement methods with advanced data analysis, reflecting an evolution in healthcare fraud enforcement strategy. Undercover agents conducted site visit interviews and surveillance, while auditors examined billing patterns for anomalies that could indicate fraudulent activity. Software system flagged providers who billed far above average volumes, used immovable combinations of procedures, codes, or showed repeated discrepancies between billed and documented services. Once patterns were detected, subpoenas and the grand jury investigations followed, allowing the prosecutors to compile the evidence sufficient for the criminal indictments. This integration of technology, field investigation, and financial forensics became a hallmark of the 2025 takedown, enabling the authorities to identify hundreds of defendants across dozens of schemes simultaneously. As revealed in Part 3, also the variety of roles played by the different defendants. Some were medical professionals directly providing false documentations or prescriptions, while others were business operators, recruited, or financial coordinators facilitated the fraudulent billing. The Department of Justice highlighted that in many cases individuals were paid based on the volume of claims submitted rather than any legitimate clinical activity, creating an incentive structure that directly encouraged abuse. Court documents detailed instances where kickback arrangements were used to recruit beneficiaries or providers, and financial flows were meticulously traced through banking records and offshore accounts to prove conspiracy and intent. The 2025 enforcement efforts also prompted immediate administrative response designed to prevent ongoing future fraud. The CMS moved to suspend billing privileges for suspect providers, halt reimbursements for high-risk claims, and implement stricter verification procedures for new provider enrollments. These resources complemented the ongoing criminal proceedings, demonstrating a proactive approach to safeguarding the federal healthcare programs while investigating trials were underway. Finally, in Part 3, highlighted the importance of the public-private cooperation and the healthcare fraud prevention insurers, hospitals, pharmacies, and regulatory bodies, which increasingly share data and insights with federal agencies, enabling more detection of suspicious claims and whistleblowers, which played a critical role with dozens of quantum action, often filed or expanded connections with the broader 2025 takedown, demonstrating that insiders often provided the earliest warnings about the fraudulent activity. The energy between the whistleblowers, investigators, and the prosecutors became a central theme in achieving both the criminal indictments and civil recoveries, illustrating that the endorsement is most effective when multiple stakeholders are engaged and the information flows freely between public and private entities. By the conclusion of Part 3, it became clear that the 2025 takedown represents not only a massive enforcement achievement but also a strategic evolution in healthcare fraud investigations. Combining technology, interagency coordination, legal innovation, and an emphasis on human impacts, which was used to create a model for future fraudulent operations, while sending a strong message to potential fraudsters that the federal government will pursue complex nationwide schemes with relentless and coordinated force. In the wake of the historical 2025 National Healthcare Fraud Takedown, the enforcement landscape for healthcare fraud. I'm sorry, one second. Yeah, and the healthcare fraud in the United States entered a period of intensified scrutiny of expanded civil and criminal consequences, and a broader recognition that combating fraud was not merely a matter of one of arrests, but a sustained, multifaceted enterprise involving thousands of investigations, regulatory reform, interagency coordination, and renewed emphasis on deterrence and systemic vulnerability mitigation. As evidenced by a series of developments that unfolded the months following the initial announcement of the 324 individuals, including the 96 licensed medical professionals, had been charged with schemes involving over $14.6 billion in alleged fraudulent billings to Medicare and Medicaid and other federal health care programs, a figure that more doubled the previous record for such takedowns and set a new benchmark for the government enforcement actions in this domain. In addition, the criminal prosecution efforts, the civil efforts, actions under the False Claims Act surged with settlement and judgments in the let me see. With the settlements, enforcement action under false acts. In the fiscal year of 2025, my bad. 6.8 billion is the highest in history, in which over 5.7 billion was directly linked to the healthcare fraud cases, reflecting the continuity centrality of the FCA enforcement as the government's principal tool to recoup funds lost in fraudulent claims, to impose significant penalties and damages on wrongdoers, often in parallel with the criminal prosecutions or as separate civil matters. These recoveries came alongside the 1,297 quantum lawsuits, whistleblower-initiated FCA actions, and 401 new investigations opened for the year, showcasing that the momentum against healthcare fraud extended well beyond the initial takedown and into a myriad of other alleged schemes that the government continued to pursue. The outcomes from the takedown itself also played out in courts across the country, as individual defendants entered guilty pleas, reached plea agreements, and faced trial, each case contributing to the evolving narrative of consequences for the healthcare fraud. In Connecticut, a nurse has pleaded guilty to charges related to illegal prescribing practices, which was revealed to have written Schedule 2 and Schedule 4 controlled substances prescriptions without appropriate medical evaluation, with 5 of her patients dying shortly after receiving these prescriptions. Underscoring that healthcare fraud prosecutions can intersect with profound public health and safety harms beyond financial losses, and that sentences for these offenses can bring serious prison terms of up to decades as well as significant financial penalties. Elsewhere, a nurse practitioner in New York pled guilty to a healthcare fraud and an unlawful distribution of controlled substances after submitting false claims of psychotherapy and related services, with the restitutions, fines, and potential long prison sentences reflecting the dual civil and criminal consequences that defendants can face when their fraudulent conduct harm patients and defrauds taxpayer-funded programs. The enforcement aftermath also saw the government seizing over $245 million in cash, luxury vehicles, cryptocurrency, and other assets believed to be deprived from the fraudulent proceeds, demonstrating the practical use of assets forfeitures and stripping alleged fraudsters of their ill-gotten gains, and reinforcing the messages and the financial crimes will be met with financial consequences, not merely penal sanctions. Imperial of the Centers of Medical and Medicaid Services leveraged its fraud prevention system and advanced machine learning and analytics platform to block payment of more than $4 billion in fraudulent claims that had been flagged or suspicious or even before they were dispersed, illustrating a shift toward proactive prevention rather than retrospective recovery and contributing to the strategic pivot in how healthcare fraud is combated nationwide. As part of these responses efforts of the CMS also revoked or suspended the billing privileges of over 205 providers whose billing patterns raised red flags or were also found to be non-compliant with the federal program rules, signaling the administrative consequences accompany they often precede criminal and civil enforcement actions and protecting program integrity. Recognizing the legal action alone would not sufficiently deter or prevent future fraud, federal agencies renewed their focus on structural and policy reforms. On July 2nd, 2025, the Department of Justice and the HHS announced the sharpening cross-agency coordination, advancing priority enforcement areas, and using data analytics to identify emerging fraud trends and leads, an initiative that built on earlier the FCA enforcement frameworks and signaled a long-term commitment to sustained oversight and resource sharing among key enforcement bodies. The working group monthly meetings and joint efforts expanded the government's ability to integrate insights of the CMS's Center for Program Integrity, HHS and OIG, U.S. Attorney's Office, and DOJ Civil Division illustrated that enforcement priorities would increasingly align with the strategic data-driven approaches to be determined complex fraud schemes. The policy backdrop of these enforcement efforts was also shaped by the broader trajectory of the United States healthcare fraud enforcement in 2025, which experts noted was marked by aggressive action and expanding risks for providers and organizations. And the healthcare and life science sectors, with intensified scrutiny of billing practices, compliance obligations, and potential for both civil and criminality liability. If standards were not met, the expansion and enforcement urgency followed years of incremental increases in the FCA recoveries and healthcare fraud cases, culminating in the 2025's record-breaking activity that kept healthcare um, at one. Let me see here. Sorry, one second. The expansion and enforcement urgency followed years of incremental increases in the FCA recoveries and healthcare fraud cases, culminating in the 2025's record-breaking activity that kept healthcare at the forefront of federal anti-fraud priorities, even as other sectors face enforcement pressures under the same statutes. The noteworthy result of the increased enforcement focus was uptick in provider education and compliance investments as healthcare entities, large and small, sought to mitigate exposure to the SCA claims by beefing up internal auditing, compliance training, and systems to detect potential false billing before they triggered enforcement actions. The systemic effects of the takedown and the related enforcement trends also rippled through the legislative and regulatory arenas, contributing to the discussion in Congress about further strengthening of the anti-fraud provisions, enhancing beneficiary identity protection, enhancing telehealth billing oversight, and bolstering prescription drug monitoring programs, all areas identified by the auditors, investigators, and policy analysts as a persistently vulnerable to abuse when proper safeguards are not placed. The semi-annual report of the HHS Office of Inspector General noted that the government monetary impact from enforcement, including healthcare fraud actions, added $2.43 billion in its reported impact on one reporting period and contributed to excluding over 1,336 individuals and entities from the federal programs for various violations, which included fraud convictions. Reinforcing that administrative exclusion remains a critical tool in removing bad actors from the system. In the broader context of the enforcement outcomes, the False Claims Act expanding role in combating healthcare fraud cannot be overstated, with the FCA recoveries making up the lion's share of all civil fraud settlements and judgments in 2025, including a significant portion tied directly to the healthcare industry, the misconduct, the whistleblowers whose quantum actions then uncover fraud that government investigators might not otherwise detect. The record volume of whistleblower filings in 2025 highlighted the continuing importance of incentivized private enforcement in supplementing government efforts and underscored that the healthcare fraud is combated not just by the prosecutors and the regulators, but also by the individuals inside of those close to fraudulent, um, you know, enterprises who chose to come forward with the evidence. The narrative of the 2025 breakdown and its aftermath extended beyond mere statistics. It represented a turning point in the national approach to healthcare fraud enforcement. One of these data analytics contained, it coordinated multi-agency actions, civil and criminal deterrence, and exploitation, the tens of billions of dollars involved in concert with the protect federal healthcare programs from exploitation. The tens of billions of dollars involved um, and intended fraudulent claims and the billions in preventive payments, the hundreds of defendants charged, and the billions recovered and secured through settlements all convey the scale of both the threat and the government's response with the human toll of schemes that endanger patients and betray public trust, which underscores why the enforcement remains critically important as the healthcare landscape continues to evolve with new technologies, services, delivery modes, make telehealth, and shifting regulatory enforcements. The experiences and lessons from the 2025 National Healthcare Fraud Takedown will likely shape how enforcement is conducted and how compliance cultures are fostered in the years to come, with the overreaching goal of ensuring that the public health programs serve their intended beneficiaries with integrity and that abuses are met with resolute and substantive accountability. Now, before we move on to part 5, let's see here. As the dust settled from the unprecedented 2025 National Healthcare Fraud Takedown, which charged 324 defendants and exposed schemes totaling over $14.6 billion in intended losses, attention shifted to the long-term consequences and lessons in such a sweeping enforcement action. Federal agencies, including the Department of Justice, the Housing of Homeland Security, and the OIG, and the CMS emphasized that while criminal prosecutions and civil settlements delivered immediate accountability and financial restitution, the larger mission was to reshape the healthcare landscape, to deter future fraud, protect the vulnerable patients, and strengthen the program's integrity. Analysts noted that the takedown demonstrated the need to have a holistic, multi-pronged approach combining aggressive enforcement, proactive data monitoring, systemic policy reform, and enhanced provider and patient education. One of the most significant outcomes was the strengthening of interagency coordination. The Department of Justice and the Homeland Security expanded their collaborative frameworks, integrating insights for criminal investigations, civil FCA actions, and administrative oversight. The renewed Free Claims Act Working Group became a central hub for strategy, intelligence sharing, and prioritization, helping identify emerging patterns and fraud schemes before they matured into large-scale losses. The coordination ensured that the agencies could act simultaneously on multiple fronts, aligning criminal indictments, civil claims, and administrative actions against providers under the investigation. Policy reform and systemic safeguards also gained momentum in the aftermath of the takedown. For example, the CMS implemented enhanced provider enrollment vetting procedures, requiring stricter verification of ownership structures, licensing statutes, and financial relationships that could signal the conflicts of interest or kickback schemes. Telehealth oversight received renewed focus with new rules designed to prevent exploitation through volume, low quality, and service. Prescription drug monitoring programs were expanded, and pharmacies faced stricter auditing protocols to curb illegal diversions. These measurables reflect an understanding that healthcare fraud is not only a criminal case, The human impact of the takedown remained at a local point for public messaging and policy considerations. Investigations revealed the patients were often directly harmed by fraudulent schemes, whether through unnecessary procedures, delayed care, and proper prescriptions of the diversion of critical Medicare resources. The Department of Justice official repeatedly emphasized that the fraudsters were not merely stealing taxpayer dollars, but actively see another long too.
He also felt they were horrific and horrible. I don't know anyone who could watch that video and not have that emotion.
The takedown also emphasized the growing importance of international collaboration. Several schemes involved foreign-based entities that funneled fraudulent claims to the United States shell companies or manipulated cross-border financial channels. Law enforcement recognized the future success of combining healthcare fraud while dependent and global intelligence sharing, cross-border legal cooperation, and monitoring of international financial transactions also resulted in the Department of Justice and the HS began coordinating more closely with internal law enforcement agencies. Financial coordinators and foreign healthcare authorities identify emerging threats and disrupt schemes before they reach the United States systems. Finally, the takedown legacy extended into the legislative and regulatory spheres. Lawmakers used the findings to justify enhanced funding for fraud programs, tighter beneficiary protections, and stronger enforcement provisions in Medicare and Medicaid regulations. Proposals including increased funding to the CMS fraud prevention system, expanded criminal penalties for healthcare fraud, and the creation of a permanent interagency task force focused on cross-cutting multi-jurisdictional schemes. These initiatives demonstrated that the lessons of the 2025 are not merely about pushing past behavior for restructuring. It demonstrated that the lessons of the 2025 were not merely about punishing the past behavior, but the restructuring.
Women are women first. Guys can separate. Shall we cover Hunter Biden's laptop? No, we should not. Why not? That's a news story. It hurts.
In conclusion, Part 5 underscores the 2025 National Healthcare Fraud Takedown was far more than a record-setting enforcement action. It represented a paradigm shift of how healthcare fraud is investigated, prosecuted, and prevented. Its outcomes reshaped interagency cooperation and formed technology-driven preventative measures influenced policy and regulatory frameworks, strengthened compliance cultures across the industry, and elevated public fraud or congressional awareness of systemic vulnerabilities. The lessons learned from the takedown continue to inform strategies designed to protect patients, ensure the program's integrity, and maintain public trust in the federal healthcare systems, creating a long-lasting framework that balances enforcement with proactive prevention and setting a new standard for healthcare fraud deterrence in the United States. Without this deep dive into the largest healthcare fraud takedown in United States history, one thing should be crystal clear. This wasn't just about money, numbers, or court cases. This was about trust. Trust in the system that millions of Americans rely on for care. Trust in professionals who's supposed to protect patients, not exploit them, and trust in institutions that exist to serve the public, not looted from the inside. What the 2025 National Healthcare Fraud Takedown exposed is how vulnerable massive systems become when oversight fails, and how serious the consequences are when greed is allowed to override ethics, safety, and accountability. But also showed something else. It showed just as important that coordinated enforcement, transparency, and public awareness can still shine a light on the darkest corners of the force real accountability, to force real accountability. If you found value in this breakdown, if it helped you better understand these schemes, operate how they're uncovered, and how they matter, please take a moment to like and share this video to others and subscribe to the channel. Doing this doesn't just help the algorithm, it helps the conversations reach more people that care about accountability and what's really happening behind the headlines. And if you want more in-depth reporting and the long-term breakdowns and unfiltered analysis of the stories that shape our systems and our politics and our lives, make sure you come back. This channel exists to dig deeper, ask the hard questions, and to connect the dots others won't. More content like this is on the way, and if you stay tuned, you'll be a part of a growing community that values context over noise and facts over spin. Thanks for watching and thanks for listening, and I'll see you in the next one. Peace.